I'm a child and adolescent psychiatrist, and one of the things I do is I see people who have psychiatric problems. About 70% of children and adults with autism spectrum disorder also have some sort of comorbid mental issue, whether it's ADHD or anxiety or depression, gender dysphoria. There's a number of things that go on in association with an autism spectrum disorder. And these kids and adults are at a higher risk for any of those kinds of issues. And that's a lot of times what I'm trying to help with. It's very common for me to see younger kids with autism spectrum who have a hard time focusing, paying attention, they're hyperactive, and we may look at treating them for ADHD. We see lots of kids who are very anxious, struggle with obsessive kind of behaviors, a lot of anxiety in certain situations, and we may want to teach them behaviorally or therapeutically to adapt to those situations or cope with those situations, but sometimes medicines are helpful for them in those circumstances. I see a lot of autistic spectrum kids, especially higher functioning ones, who get to be 12, 13, 14, and there becomes a self-awareness that I'm different than other people, that other people are communicating in ways that I don't communicate, maybe that I'm lonely, that I'm not as connected with other people, and other people have relationships that I don't have. And I see depression, I see frustration. Why is this happening to me? Why do I have an autism spectrum disorder? Why am I different? And you see them struggle with spiritual issues, you see them struggle with emotional issues in those circumstances. They look depressed, sometimes they feel suicidal even. And so when I'm helping, those are things I might help with. So everybody's different, right? So that's one thing you can say. Why am I different? Again, my short answer is I don't know. We don't know what causes an autism spectrum disorder. I don't know why you're different. You are different. And we're going to have to figure out, do you want to change to try and be more like other people and not be different? Or do you want to be who you are and try and figure out whether I can be accepted by other people for being different? There's a little bit of both. We're social creatures. We want to fit in, and so to some extent we don't want to be different. On another level, we're very independent kind of creatures, and we want to be ourselves, and we want to be a little bit different. And so we can embrace some of our differences, but some of the differences we're going to have to adapt in order to fit into a particular community. We're going to have to be able to do certain things. And that's a constant tension for folks. And I'll have that kind of conversation with people, talking with them about, well, what do you want to do? Do you want to fit in with everybody else or not fit in? Are you comfortable with who you are? And you want people to accept you for who you are? But you have to understand, all of us may not be accepted by somebody for who we are. And we're going to have to live with the fact that everybody doesn't have to like me. Everybody doesn't have to be my friends. Most common thing I ask kids on the spectrum, especially as they're teens, are, do you feel lonely? Many of them are like, no, I'm not lonely. I have a friend, or I have no friends, but that's okay. I'm not really interested in any. Parents struggle with that. He doesn't have any friends. He doesn't talk to anybody. It's like, but he's not unhappy about that. You wanted to have more friends. You're unhappy with the fact that he's more an isolative, kind of solitary kind of person. But he's not unhappy with that. He's very happy with that. But when he says, I want more friends, or I am lonely, or I do wish, well, now how can we work on helping that to happen? You know, when I talk with my doctors, my doctors in training, one of the things I tell them is, when you're interacting with somebody who's on the autism spectrum, always talk to them, always treat them as a person, even if they're nonverbal, if they appear sort of not functional. There's a person in there. We don't always know what they're like. It'd be interesting to sort of see if we could help them to communicate, that they could express what's going on with them. They understand way more than we give them credit for sometimes. And I tell people that all the time. One takeaway is they understand a great deal more than they can express. Their receptive communication is oftentimes way better than their expressive communication. And so we should be aware of what we're saying in front of them and how we're treating them, because they pick that up. Sometimes they don't seem as if they care, but I think that they do. Sometimes they seem as if they don't understand, but I think they do. And they are capable of doing some really cool things.
Visit us online at wqed.org/autism for more web extras, links to resources, and to watch the documentary Autism Aging Out.